We measure GDP by number of jobs, etc. But now it's going to be, you're going to get doctors' jobs free. You're going to get tutors' jobs free. You're going to get maybe legal advice free. So GDP will have a different meaning altogether. People are gaining by AI.
Yeah. If you define GDP as a basket of goods and services you can consume, then we will have great abundance. How they are priced, all those prices go to zero. The typical measure of GDP goes down. If you take something that costs $1 million, like a computer, and sell it for $100, which is what's happening today in a cell phone, it has the computing power of a machine that cost $1 million not very long ago. GDP actually declines. So GDP is a poor measure in hugely deflationary economies, and I think we'll see a deflationary economy. But the production of goods and services will go up. Now, this isn't without concerns. Obviously, AI will do this by replacing jobs. And so some level of redistribution of value to people in the lower income stratas is going to be very necessary in the world of AI. And we can go into the economics. The economic implications are very significant. Policy will make a huge difference, and policy will often be determined by politics. So all those things are more the constraint to see this world happen than the technology capability. And I hope somebody like PM Modi takes on the task of saying, I'm going to make free healthcare available. Hospital surgery is different than expert opinion. The opinion of,
Right.
of a gastroenterologist or a neurologist or an oncologist or a primary care doctor or a mental health therapist, that's going to be free. If you're doing beds in a hospital, that's not going to be free. Drugs hopefully will get cheaper, but they are not cheap today because drug companies have a monopoly. But AI is designing new drugs. So 10 years from now, the number of drugs per disease will go up dramatically, which means pricing will come down.
You mean AI will develop those drugs? So there'll be many,
Yes.
many more options available.
Yeah, the first drugs designed by AI are likely to enter what are called clinical studies this year. Now, those studies can take 5 or 10 years because drug development is a very long process, but it's a beautiful possibility. So drugs, even diagnostics and blood tests and imaging, x-rays, all those can be reduced in cost because you don't need a radiologist to read those studies.
Now, one of the things you mentioned is that AI can take you so far. But then when it gets very complex, or certain physical surgery is needed, or x-rays needed, or these various kind of radar tests, those are physical things. So they'll take you to that point, but then you'll have to have a human intervention, what you call a triage, is that?
AI software won't solve all problems, but it will solve many, many problems.
Exactly.
I think we have to keep this in mind. And when the physical world is involved, robotics AI is probably 5 to 7 years behind where software AI is, or intelligence AI is.
By robotics, you mean a robot actually doing the... Sorry, by robotics, you mean a robot actually doing the surgery. That's what you mean, is it?
Yes. That's not likely to happen in the next 10 years. It will happen at some point, probably in the late 30s. But let me make the following point. If you have a diabetic or a cardiac patient, and you're better managing their health, their drugs, what dosage they should get, drug titration as it's called, what food they should eat, and you'll reduce the number of surgeries needed, cardiac surgeries or other surgeries related to diabetes or hypertension. So I do think you can reduce the amount of healthcare needed in the physical world by taking care of patients early with AI.
I mean, it really is a completely different world that you're looking at. And honestly, the fact that you've been correct in many of your foresights, I really am so enthused by this, that this could be a
Yeah.
new India where the poor benefit the most, actually.
The poor will benefit the most, which is the purpose of the blog I wrote, which is on our website, what AI can do for India. And I gave a
Right.
talk on it at the Computer History Museum in December. Same
Right.
idea. We can do a lot for the bottom half of the Indian population, obviously also for the top half. And even other things like entertainment will be nearly free. Now, we will need much of the government to step up and provide these services because they will be so cheap. It'll be easier to provide even for the government, and you won't create large budget deficits to make this happen. So I'm really excited about the economics of it also. But the long term is very, very exciting. Obviously, there's some things that are harder to affect. Housing and food are two things poor people need a lot of. And those are harder to affect with AI's expertise or intelligence.